Hello everyone, we welcome you all for our conference Magical Formula 2021, and in this conference we are going to show you the magical formula, magical treatment for the knee pain and heel pain. And today in this session we are going to discuss for the one case about the heel pain. Heel pain is very common in society, and two most common cause of heel pain is a plantar fasciitis and second one tendinoachillitis. And we have Asmita with us, and she was suffering from tendinoachillitis since long time. And let me ask her a few questions about Asmita. What are symptoms in your leg, and when it was started?
It started off way back in 2012, but it was a little bit of pain, which I used to endure it for a long period of time. But then in 2019, something drastic happened somewhere on the airport or somewhere, and the pain aggravated to a very great extent. And then it was becoming very difficult for me to have my normal work schedules and my walking schedules and everything. And I was much worried about it, consulted many doctors, but they said that there is no surgery, like painkillers would be the only option. The surgery is very tricky and very dicey, so it's better not to go for the surgery. So anyway, I was bearing with that. That's how it is. And then I came to know about you people, and then I consulted you.
So this pain was, I think, disturbing you lots of time in your professional life also.
Oh yeah, I was a teacher, and my profession obviously is of standing and walking all the day long. So yeah, it was hindering me in my profession as well. That's true.
Okay. And whenever you are doing some exercise, some jogging, and at that time also you are feeling the pain?
Oh, I miss that. I'm a evident walker. Like, yeah, I really like walking morning walks, and I had to discontinue that after 2019. Yeah, 2019, before COVID, I had to discontinue with my regular morning walks because that was too painful for me.
Now, one more question about the about the characteristic of the pain. So when you are awake in the morning and when you do the first step out of your bed, how was your pain, and that pain gradually relieved or not?
The pain when I get up in the morning is too excruciating, and it doesn't go. It goes slowly, of course, but it doesn't go by maybe 100 and 150 steps till then, and then slowly it does reduce but doesn't go away totally.
Okay.
Yeah.
So, and these everyday's affair.
That's everyday affair. Yeah. Not only just everyday affair. Like even if I rest for a few hours, 2 hours, 3 hours, and then if I get up again, the first few steps are really, really painful.
So typically there is the tendinoachillitis pain or plantar fasciitis pain. So these are inflammatory pain, and this pain is typically very more in intensity after prolonged resting hours. So whenever we take the rest, like we are asleep in the night for 6 to 7 hours, and the first step after the bed, it is very painful, and gradually little bit of pain intensity is reduced after few 100 steps or 200 steps, and this is typical of inflammatory pain. And such kind of tendinoachillitis pain or plantar fasciitis pain, this treatment is very, very useful.
An antegrade puncture of the left femoral artery, common femoral artery, and with a 4 French sheath, and we'll be going super selective into the vessels supplying the plantar fascia or the tendinoachillis, and we'll go with the help of diagnostic catheters and our special wires. We'll go from the superficial femoral into the popliteal, and from popliteal into the posterior tibial artery. This is done under continuous fluoroscopic guidance as you see in the cath lab machine, angiography machine. We take DSA, digital subtraction angiography, from the distal popliteal artery to map the calf vessels. There are 3 calf vessels, anterior, posterior tibial and the peroneal. So we'll be going in the posterior tibial artery. We use microcatheters for superselective cannulation. They're very thin catheters and they don't damage the vessel, so we can go super selectively in this. So we are inside the tibioperoneal trunk. Wire apo? This is the super selective diagram of the tibioperoneal trunk, and from here we'll go into the posterior tibial artery. Roadmap apo?
Ask one, sir.
So what we do is we take a road map, so we know exactly where we are going in real time.
So there is a case for heel pain, and when we are talking about the heel pain, there are lots of causes for the heel pain, and there are a few common causes as plantar fasciitis and tendinoachilitis, and there is at least 20% of the patients from the heel pain, they are suffering from a neurological pain. So there is one nerve which is passing through the calcaneum, and if these nerves got compressed, then patients have continuous neurological pain. So these all things should be differentiated. The source of pain, what we are targeting, it should be the inflammatory origin.
Remove road map.
So this is very good for tendinoachilitis, plantar fasciitis. This treatment works wonderfully in such case. Now another things it should be noticed for this heel pain, particularly for the plantar fasciitis. Many times cortisone injections is given. So these are steroid injections given for the treatment of plantar fasciitis pain, that is heel pain. And what happened that this steroid injection actually giving more fibrosis into this tendon.
Hello.
And actually it damages more rather than helping. So now let's look on the angiography.
We have gone very super selectively in the posterior tibial, very distally up to the ankle joint. Let's see what the angiography says. NTG आपजो. So there is hypervascular blush at the site of Achilles tendon insertion at the calcaneum. We can see rest of the vessels and rest of the plantar arch. They are not showing any blush. They are just branches are seen, but not the blush is seen. Here we are seeing the blush of the inflammation, the inflammatory blush at the site of insertion, and that is the site of the pain clinically also. So everything matches with the inflammatory pain here. And what we'll do is we'll go super selectively in that branch supplying the blush, and we'll embolize it.
So we are talking about these steroid injections. So what happened that when we give the steroid injections for the plantar fasciitis, so these steroid injections, it creates more fibrosis within the tendon. So it makes more fragile. So steroid injection actually harmful for into the case of plantar fasciitis or the heel pain. Second thing, it creates a fat atrophy for the heel pad. That is one fat pad beneath the calcaneum, and when we give these steroid injections for the treatment of heel pain, it creates atrophy into the fat pad. So cushioning effect of the calcaneum is reduced at the into the heel, and it creates a lots of trouble, particularly into the older age group. So
it also creates tendon rupture, is it?
Yes. So it creates more fibrosis within the tendon, and they make the tendons prone for rupture. So this is a classical vascular burst, what we are seeing right now, and this is a culprit of inflammation. And See, Dr. Okuno has published this paper in way back in 2013, and he has mentioned that at the site of inflammation there is always new angiogenesis. So there is a hypervascularity, which is suggestive of inflammatory sites, and we actually selectively canalize that vessels and inject this embolizing material in it. So there is a selective cannulation of this feeding artery, and this is very important step in any embolization, because non-target embolization can create a lots of trouble. So we use a roadmap, and with some guide wire technique, selectively canalize this vessel. Now you can see over here, classically the site of tendinoachilitis is these arteries supplying at the Achilles tendon, and this is a vascular blush. What we see generalized now, these are only artery which is culprit for this vascular blush.
So we have gone inside the calcaneal branch. We are also seeing the collaterals, and now we'll embolize the blush with the very small microparticles. These microparticles go up to the capillary level, and they block the hypervascularity, and thus by blocking the hypervascularity, we are able to reduce the stimulus to the sensory nerve endings present there, and hence the pain reduces.
So these embolizing particles are just small 50 microns particles, and it targets the end vessels, capillaries, which is end vessels, and after the capillary the venous network starts. So it doesn't target the parent vessels, because parent vessel size is more. So when you are injecting such a small embolizing particles, so the target vessel is the end vessels, and these end vessels are really culprit which releases the cytokines, which are the inflammatory markers, and it gives more and more pain to the patients. So right now you can see over here that we are injecting these embolizing particles, and these end vessels are filled up with this embolizing particle, and we hope that vascular blush will disappear into the post-embolizing angiography image. So there is a post-embolization angiography image. You can see over here that the vascular blush, what we see at the site of insertion of tendinoachilles, is totally disappear. And this is what we expect the end results. Vascular blush should be disappear, and then we can achieve we can eliminate the inflammation from the site, and because of the elimination of the inflammation from the site, post-operative pain is reduced significantly. So thank you so much for attending this case, and this is really magical treatment, because there are lots of for particularly when we are talking about the heel pain, there is no other option available for treatment. Like not any surgery is advisable for plantar fasciitis or tendinoachilitis, because actually tendon is not ruptured, right? In tendinoachilitis or plantar fasciitis also, the plantar fascia is intact, is not ruptured, but the inflammatory pain is so much that patient is suffering a lot during the day-to-day activity. And this is just done with the single needle puncture and the local anesthesia. Within 3 to 4 hours, patient is able to walk. And
Yeah.
so this procedure is really magical for many patients. Thank you so much.